Last week, the White House announced that President Trump was diagnosed with chronic venous insufficiency. It was addressing the bruises on his hands and swelling of his ankles. It's a condition that many people may be familiar with. Earlier this afternoon, I talked with Dr. Scott Cameron from the Cleveland Clinic to explain more about this condition. Dr. Cameron, what are the signs and symptoms of chronic venous insufficiency?
Most commonly, chronic venous insufficiency manifests as limb swelling. It will also manifest as discoloration of the skin in some cases. Sometimes you'll see patients on the beach or in the airport that have a brown discoloration of the shins. And the third thing that I think most folks can identify with is varicose veins. So varicose veins is basically chronic venous insufficiency in which the veins are now visible to the eye.
What causes this condition?
Chronic venous insufficiency is a chronic and a progressive disease that needs lifelong management. Most of the time, it's caused because the pressure inside of the vein has become higher than it should. And there are many causes for that. One is carrying too much weight. So if you carry too much weight in your abdomen, it pushes down on the veins in the abdomen, and all that pressure is transmitted into the veins in the leg. Or if you have a patient, for example, who's had multiple pregnancies, and the head of the baby is pressing down on the veins for a period of time, that pressure can cause fluid to leak from the vessel into the tissue, and so that's where the limb swelling is manifest. But the other thing that sometimes happens is you get damage to the valves inside the veins. So all veins are lined with valves that open and close, and if those become damaged, you'll develop chronic venous insufficiency. And then lastly, if someone's had a blood clot in the legs, blood clots can damage valves and damage veins, and so not infrequently we'll see patients who've had blood clots in the limbs develop chronic venous insufficiency.
You mentioned lifelong management. How can this condition be treated?
So most of the time, we try and treat chronic venous insufficiency conservatively. And so conservative treatment would consist of compression, wearing compression stockings. I think most folks are relatively familiar with that. In some cases, in the case of varicose veins, if we find out that the valves are irreversibly damaged, and there are sophisticated imaging tests that we can perform for that, occasionally we'll recommend a bit more of an invasive procedure, such as removing the vein. That's called a phlebectomy. We do those actually in our section in Cleveland Clinic on an outpatient basis. And then there's another procedure where you can use heat to close down the vein that's not working properly. That's a procedure called endovenous laser ablation. And then lastly, you can sometimes inject an agent called a sclerosing agent. And the sclerosing agents will close some of the smaller veins. And then in many cases, patients will get some symptomatic relief from those procedures, but we tend not to recommend them unless they've failed conservative therapy.
What are the dangers or concerns here if it goes untreated?
So chronic venous insufficiency, I'll tell you, is not only undertreated, but it's also underdiagnosed. And the reason it's underdiagnosed is vascular disease is not taught very well in medical schools in the United States, or even in postgraduate medical training. In a patient who has untreated chronic venous insufficiency, most of them untreated will develop a secondary condition called lymphedema. Lymphedema is a chronic, even more serious vascular condition where you'll get irreversible damage to the lymphatic vessels that would normally remove that extra fluid in the leg. So for example, most people, myself included, at the end of the day, if I've been standing a lot or rounding in the hospital, I'll see a little bit of swelling in my legs. The next morning, that swelling is mysteriously gone. And the reason it's gone is the lymphatic vessels have taken that fluid, they've delivered it back inside the blood vessels where it belongs. But if you've got chronic venous insufficiency and it progresses to lymphedema, you cause inflammation of those lymphatic vessels. And so now you have an irreversible cause of limb swelling, and then even in some cases, ulceration of the skin and infection.
Well, very fascinating and interesting. Dr. Cameron, we appreciate you talking with us today about it.
You're most welcome. Thanks for the questions.